For more on this, I want to bring in Mr. Ralph Neas, who was joining us tonight. He's the CEO of the National Coalition on Healthcare. Mr. Neas, good to have you back with us here tonight. What do you think the American people want? If the American people were writing this, what do you think they would say?
Ed, they really want health reform, as you said. They want comprehensive health care reform that is sustainable. And that means you have to have coverage for all. But as you said, very importantly, you have to have cost containment. We have to cut the rate of increase in health care costs. Many people know this already, but in the last 10 years, health care costs have gone up 130%. Wages, 34%. That's outrageous. Cost control has to be part of the mix as well as quality.
Mr. Neas, are the Republicans winning the spin game early on this? Because they're saying the government's going to be between you and your doctor, and you don't want that. In fact, they've gone so far as to say, Orrin Hatch said, Democrats would live to regret it if they insist on a public plan. What do you think?
I think that President Barack Obama and the congressional leaders are doing a fine job in terms of reaching out to the Republicans, in terms of bringing everybody to the table, all stakeholders. I think they've got a good message. There are Republicans, and I think Chuck Grassley would definitely take back that bit of twittering over the weekend because he has been working hard with Senator Max Baucus. Senator Mike Enzi has been working with Senator Kennedy and Senator Baucus. There is a bipartisan attempt in the Senate.
But there's also, Ralph, I got to jump in here. There is also an unprecedented amount of money that is going to fight any reform on this. Where's the good money going to be coming from? On the side of the people. The money is out there for the health insurance industry and for the HMOs and for all of those who don't want any reform. And we're talking millions of dollars that's going to be spent in the next few months. Where's the pushback on this financially?
Ed, I was working on this back in 93 and 94, and those who wanted systemic, system-wide health care reform were defeated in large measure because of rhetoric that just wasn't truthful and unbelievable amounts of money. And you're right, we've got to assume opponents will spend the money. This time, proponents of comprehensive health care are prepared with messages and communication. The money is being raised, and there is coordinated leadership downtown on Pennsylvania Avenue as well as on Capitol Hill. We're going to get it this time.
All right.
We're going to get it this time.
I hope so. Millions of dollars being thrown against any effort to reform, and also the president has asked for people to go out and attend town hall meetings. Mr. Neas, good to have you with us tonight. All right,
Great
folks, get your phones out because I want you to weigh in on this, and it's a simple question. Do you trust your health care, insurance companies, or the government? Where do you want to go? Text A for insurance companies, B for the government, to the number on your screen. We'll bring you the results later in the show tonight. For more on this, let me bring in David Lazarus. He's a business columnist for the LA Times and has spent a lot of time covering the health care. David, what do you think the American people want? If they were going to write this thing out, what would they put in there?
Oh, I think the American people have made it very clear that, first of all, they want change, but mostly they want fair treatment. Time and time again, Americans say, look, we'll pay for health insurance. We understand what insurance is all about, but at the same time, we don't want to be gouged, and we don't want to be treated like lepers just because we finally come to use the product that we've been paying for every month anyway. And that means, for instance, no exclusions for pre-existing conditions, no higher payments for people who are sick, and no deep gouging and no nickel and diming for the little stuff, and then no one's there for you for the catastrophic stuff. People just want to know that they've got a safety net.
David, does the Senate get it? I just don't hear enough Democratic senators out there saying we're going to do this. I just don't sense the passion out of Washington, and it's almost like they're afraid of the establishment because they could get targeted during an election. What do you think?
And I think what the Senate gets is plenty of do-re-mi from the insurance industry and from the pharmaceutical industry. They throw the money around far and wide, not just to Republicans, but to Democrats as well. That's why it's very hard to push something through. But, and this is a big, important caveat here, when they tried in the Carter administration to push reform, industry killed it. When they tried in the Clinton administration, industry killed it. This time, every player I've spoken to says there's too much momentum. You're not going to stop it. The only question now is what are going to be the contours of the plan, because there will be a reform plan.
All right. Do you think one of the heaviest lifts for the president will be to explain how he's going to pay for all of this?
Well, absolutely, that's the heaviest lift. But, you know, he's got a big out on that, too, and that is we can't pay for anything. So why is anyone going to hold his feet to the fire on this? We've got a $1.3 to $1.8 trillion deficit this year, an $11 trillion national debt. I think what Obama can say is, look, we got a lot of things we're paying for right now. This is just one of them. We'll take care of it.
I've said this a number of times that I think it's going to take, David, a effort that would parallel that of the civil rights movement in the 60s if we're going to get real reform, because the establishment is that well funded, the establishment is that adamant about keeping things the way they are. There's a trust level here that's not connecting with the American people in Washington. So can we get that done in 6 weeks? I don't know how that can happen.
Well, I think the ace in the hole here, Ed, is that the insurance industry knows that they're facing some hard times. They know that their customer base is already dwindling. They want that national mandate real badly. And the fact that the president signaled his willingness to talk about that the other day is what's keeping these guys at the table right now. The real question is Obama prepared to give up that public health plan that you were talking about earlier for the sake of keeping these guys at the table? That's going to be the real deal breaker. These guys say there is no way they want to ever see a public program, large or small, as part of the picture. I'm thinking that if he is going to agree to a national mandate, and that's probably going to be a big part of any solution here, he should not take that public plan off the table, at least not without a whole lot of gimmies from industry.
Amen to that. Now, you've done a lot of reporting on this. If the president takes that public option off the table, there's going to be a big political backlash. That's what I think. Do you sense that in your reporting?
Yes, I do, but at the same time, he's being fought tooth and nail on this. The Republicans released a letter today saying they want no part of a public plan. It seems to me that the answer is going to be that if they want the public plan off the table, then the industry is going to have to agree to really draconian price controls. They don't want that either, so the solution is the compromise. The compromise is the public plan to be some sort of counterbalance to the private plans. I think they're going to wake up to reality and see that eventually.
David Lazarus, LA Times, great to have you with us. Love your work. You have done more work on this, I think, than anybody in the media. And you know, when I go around the country, and I'm going to be in Buffalo this Saturday night, people are asking questions. How come the media is not spending more time on this? It's the people's issue. We'll see where it goes. Thanks so much, David.
Thank you, Ed.